everyone signed in? You have a, what do you call that code?
QR.
QR, thank you. QR code on the table or QR code on the door? I'm still saying slideshow. What is your teacher's name? Deck.
Slide deck.
Slide deck. Okay,
So
come on.
for people who have not been in the room before, let me give you just some housekeeping things. I'm Tammy Meltzer, I'm chair of the board. What we have on the table are what's called owls. All right, they look like these little tiny towers. They should not be touched, because they are our images for everyone who is online. It is our microphone for everyone who is online. The awesome thing is that they pick up really, really well. The not so awesome thing is it searches for your conversation to augment that versus the people at the table. Go one by one. We ask you not to whisper. We understand sometimes you might want to say something to someone. We ask you if you're going to step outside, please go around the corner to
Yeah,
the
not
north.
at the door.
not in front of the door, because it will have problems for the people who are online to have a robust experience. Alrighty, and if it was your turn to speak, please feel free. You must identify yourself and then just step over to the table. We're happy to have you here, but we like to know who you are. Okay,
Great.
with that, my housekeeping notes, I'll keep quiet for the rest of the meeting.
What do you want? So I'm Pat Moore, I'm chair of the committee. Our co-chair is not here. This is Zach Bobber, who is our district manager. We have one more committee member who's about to come in. Come on in. So as you all may have seen from the new agenda, which is on the table, we canceled the third item. But we are going to start with our new captain of precinct one.
Just to be clear, the third item is 10 South Street,
Oh, yes.
Battery Maritime Building,
They will come back, just not tonight.
postponed.
So
Well, good evening, everyone. Are you going to sit?
the owl's gonna look for you.
Good evening, everyone. I'm Rob Fisher. Been on the job for like 19 years, been a captain for about 5 years. I used to be a lieutenant here at the first, and just recently, a couple months ago, I came back as the commanding officer. I'm real happy to be here. I got a great team with me, and really happy about the opportunity.
So if you have questions, the committee starts first. And then the public can ask questions. Come on, John.
I'll kick it off.
Go over.
Stats? Yeah.
Quick breakdown?
All right, let's do year to date, all right? So year to date, we're down 19.6 with our major crimes. Right, rapes, murders 0 versus 0, rapes 1 versus 1, robberies, we have 4 this year, last year we had 6. Felony assaults, we have 0 this year, last year we had 1. Burglaries, we have 4 this year, last year we had 5. And, grand larcenies, we have 32 this year, last year we had 37. And grand larcenies of autos, last year we had 1, this year we have none. 41 for the year versus 51 last year. And our retail theft overall is down significantly 28%. We had 104 retail thefts versus 146 last year. Our petty larceny, that's a misdemeanor, we have 105 this year. Last year we had 145, down 27.6%.
You know what? So at the last meeting, the council meeting, you told us about a new initiative you had started with the Hampton corridor.
Yeah, we have it with the Fulton corridor. We also have some other corridors as well. I started a business improvement task force, and it focuses on certain areas of the commands. It's Battery Park is one, the Fulton corridor is another, Tribeca is another, and Soho is another. And the idea of the unit is that they form partnerships, relationships with the businesses in the area that have been victimized by retail theft and other issues. And they're in the area and they respond quickly to issues, and if necessary, they make apprehensions of people who committed crimes. And so far, it's been going really well, just for the year. And this is the 15th day here. They made 23 arrests. That's it. And specifically with the Fulton corridor, We have, two members, Austin Manu and also Chowdhury. They've made 6 arrests every year, 1 felony and 5 misdemeanors. And, yeah, it's going well. The task force is really working hard. And as they continue to, you know, improve these relationships over time, I think it's gonna be even better.
Are they out there 24/7? So are different,
No, they're
Team?
not.
no,
No, it's, they go out there, they're there from, they start their tour around 11:30, so they're typically they'll be out there around noon. And they stay out there till about 7:30, 8 o'clock. You know, sometimes they'll come in when they have an arrest or some other issues, and I try to get other people to go to the area specifically during those times. But when it's not during those times, our regular patrol officers are the ones that patrol these areas. We don't have, you know, the personnel to have somebody there at all times. So we try to focus on the times when we're getting the most problems.
so for those who came in late, this is our new captain, our new leader of First Precinct,
Thank you.
some more members of our committee. So committee, you get to ask questions first. Okay, John?
Yeah, well, one of my problems is, you know, I rode a bike all my life. And what's happening today is, I'm not gonna call it motorbikes, I'm gonna call them motorcycles, have been running me off the road. They're going the wrong way, they're on the sidewalk. And, you know, a few years back, my son went through a red light. A police officer gave him a ticket. Is there any tickets being given to people that have motorcycles on the sidewalk going against traffic? I'm the president of a senior center there in town called IPN. And our seniors are being, you know, afraid to walk outside because they could get hit by a car.
Mhm.
And you know, when you get older, you get hit and you fall, you don't spring back. And so I basically stopped riding my bike because they knocked me over twice, going the wrong way.
Can you be specific, John? Who is this? Is
Yeah.
it motorcycles?
Well,
E-bikes?
I call it a motorcycle, but
It's a
they'll
motorized
probably
bike.
call it a motorized bike.
But it's not gonna be a Harley Davidson, I understand.
Right,
You say
it's not,
a
it's
mobile-
not a
Yeah, or
motorcycle.
e-bike.
Right.
Yeah. I understand.
You know what I'm talking about.
Yeah.
You know, they're not as like a little bicycle anymore. They have like, you know, a little bit more power.
Mhm.
In any case, they're not supposed to ride, on the opposite, you know, they're supposed to ride with traffic. They're not supposed to be on the sidewalk. And what I noticed is that years ago, we used to get tickets. But today, is there any statistics? Was any tickets given out?
Yeah, when I was the executive officer of the 17th precinct, that was Midtown East. We did a lot of initiatives over there where we would look for the types of violations that are really gonna cause harm, like failing to yield pedestrians, you know, riding recklessly on the sidewalk, you know, riding the wrong way, of course. So we did a lot over there. They are, Captain Wong, he's the executive officer of the first, and he runs a traffic program. And, you know, he's very focused in on it, and he is having them address that. And we can do more initiatives with that, certainly. If you have specific areas that you're seeing as being problematic, we'd be happy to go to those areas and, you know, focus in on them, like doing analysis, see what needs to be addressed at those areas.
I want to tack on to what John had to say, because yeah, that was one of the things I was gonna ask you. Number one, has the city given any instructions, for lack of a better, on how to handle bikes? Because it's becoming, as we get more and more people riding bikes, we have more and more incidents. All of us in this room have almost been hit by a bike at one time or another. And I agree with John, they ride in the wrong, they do not follow the rules that they're supposed to follow, for the rules of traffic.
Absolutely. Yeah, and what we wanna do is we wanna focus, I mean, I'm not saying any violation is okay, but like, obviously, the person, bike going 2 miles per hour up the thing to do the delivery, maybe we don't have to harp on that as much as when we see the guy flying up the sidewalk, going the wrong way, and like people are jumping out of the way, you know the kind of violations that are gonna hurt somebody, send somebody to the hospital. And I visited, people, especially senior citizens in the hospital that have been hit by these vehicles. And, you know, it's unfortunate, so I mean, we will focus on those things.
So I want to tag to what John's saying and ask, I know that up in the Hudson River Park Trust, up further down in another precinct, they do hot zones. And they set up things and not stings, but education zones where they will, well, have to do it in the middle of winter, of course, but maybe. Where they literally are there explaining to e-bikers where they're supposed to be, where they're not supposed to be, doing enforcement education to try and tamp down on the amount of latency that we have. So I'd like to know if maybe, I know it's a manpower question, which might be an issue, but if we could get a couple of those going on the east and the west side, that would certainly be helpful.
I may, in the past, we have partnered with, one of the local delivery groups. They become like a union, Los Libertas.
Yep.
I think, right? So right over here at City Hall Park, they'll usually call like a little, like they'll have a little pep rally, like around, whatever their slow time is, like around, right before the lunch rush. So they'll all meet up at City Hall. And while they're there, we're giving out, information flyers on how to, like the rules of the law, like don't ride on the sidewalk, don't do this, don't do that. The union also gives out like safety helmets, and we just do a quick breakdown of what you can, cannot do. But that's only one.
Nick, just tell everybody who you are.
Detective Nick Iordano, Community Affairs for the First Precinct. So I work hand in hand with, Captain Fisher. And I probably corresponded with a bunch of you through email and all these issues that come up, on a day-to-day basis. But going back to the e-bikes thing, we try to do the education portion, but unfortunately, it might need to be some more regulation on bikes. Some people just don't
That
care.
City Hall Park thoroughfare is one of the worst places. And I thought they were supposed to dismount and go through City Hall.
They're
And, you
actually
know,
allowed to.
To ride through. I thought in the beginning, when that was opened up, they were told they had to dismount and walk.
In the beginning, it wasn't, I think it changed.
Because they close
Well,
off
it's
the
still
road.
dangerous.
But it's dangerous, because especially during this time of the year where it gets dark early.
Sure.
People getting off of work, they're walking through, and the bikes are zigzagging around, and you've seen it, to get to the bridge, and it's really dangerous.
Absolutely.
Yeah. So if we could do something about that area, that would be great.
And you put the two together, if you're at a location where you're having collisions or other complaints, and, if you see the violation is not particularly egregious, you can use that as time to educate, you need to be riding a bike over here this way, and somebody who almost hit somebody who's reckless doesn't seem to be too concerned with it. That may be an enforcement issue, you can give summons, and maybe that will change the behavior.
I hope you don't have to come visit me in the hospital, because I yell at people. You're not supposed to.
And they get nasty too.
Yeah, they do.
Yeah.
My greatest joke is I'm gonna have the intersection outside of this building named after me when I get hit by the bikes here. But, yeah. On the second idea of a task force, I'm gonna go to our least, and favorite place in the neighborhood at the moment, and that's the Battery and the ticket hawkers. It's ramped up even more recently where there have been instances, which I know Zach has forwarded to you, where the ticket hawkers are flat standing in the front of, on the Battery Place side of the park saying, oh, I'm sorry, you can't enter without a ticket. Or they're pulling cars over at the bottom of 9A with a vest that says security on it. And they're literally pulling cars against traffic. So they'll stop traffic at the bottom of the 9A to pull a tourist car over into Battery Park City for the ticket hawkers to sell. And then, show them down to a parking garage or whatever. So, I know that they fly away as soon as you show up in a man-marked car, but we definitely do need some bigger coordination and suggestions on how to make that work. Because it's become a problem for people riding bikes, it's a problem for pedestrians walking by, it's unfriendly and flat out harassment for the public. Everybody wants to make a living, I get that, but there has to be some kind of enforcement that we can do. And they're not allowed to be on the front side of the street, ending, period. So, I know you guys have worked on it a little bit, but we have legislation that's, I think Max can talk about, Councilmember Marte working on. But we'd like some other ideas of what we can do in the meanwhile for task force related that can have some teeth.
Well, sometimes what they're doing it's against a code or something like that.
Sue, can I ask, is it possible to speak a little more loud?
Yeah, of course.
Thank you so much.
Sometimes what they're doing might be something we could summons for, and maybe not something we can arrest for. So these officers that work at Battery Park, they issue a lot of summonses, and they try to keep some kind of boundaries with what's going on, and then sometimes it does rise to the level where an arrest needs to be made. But yeah, I mean, they are down there and they're trying to keep it as safe and orderly as possible, but we can, as time goes on, like I said, the task force is new, we can figure out how we can, move it a little bit to make it better.
Simple suggestion for that. The signs that state that there are scams happening have all been moved inside the park. So for any tourist who doesn't know that you can actually walk into the park, they've already been scammed once they've seen those signs. So if we can make an effort to get those signs that there are scams happening and it's a public park, that seems like an easy and simple solution that you could start.
Okay, we could look into that, moving signs, yeah, absolutely.
You know, outside Bessie Street for a while when we had the candy sellers, there was that really big DOT blinking sign that was out there saying,
Yeah.
Yeah.
That sign is, it's not that we can never get it, it's that there's only a couple of them, and they have to be shared by a lot of people, so we will try to get it whenever we can. Yeah, it's, yeah, I mean, I wish every precinct had their own sign, they could use it, yeah. Yeah. Sneak away and grab it, yeah. We haven't seen the candy stuff as much, but what we see now is like the basketball ones. And, they'll say, oh, can you donate $5? And then you'll find out that it was $1,500 that was taken or something like that. So, that's something to be aware of,
I don't know if you all know what we're talking about, where they can,
the Zelle scams, the Venmo scams, so.
what do they do? They can,
But like they'll say, oh, let me just put $5 into my thing, and then they take.
Don't hand over your phone to a stranger.
Yeah.
Your phone nowadays has more technology and is linked to all your financial accounts. And they're very creative and they're very convincing. And, a lot of people do want to donate to a basketball team.
and they're young kids, so you think they're,
So if you hand over your phone, you're thinking, get $25. Oh, I'll put in the email address for you. They wind up transferring $2,500, and then a lot of times they'll either delete the app or put your phone on airplane mode so you don't get the notifications while they hand you back your phone and they walk away. One of the good things is they haven't been violent towards the public. It's usually if you tell them, no, leave me alone, they walk away. They don't bother you after that, but time and time again, like we do get it, people do hand over the entire phone. And we just trying to tell people, like, your phone is your wallet. You wouldn't just hand over your wallet to somebody,
There's other scams that could be done, like, your family member's been arrested, you have to send some money, I'm from the IRS, you owe back taxes if you don't, like all sorts of things that you hear over the phone that, they try and scam you with.
but pursuant back to the sign, it was extraordinarily effective and could be seen for a large distance, which would be great for the park specifically because I've also seen the flags that, Statue Cruises puts up and the Battery puts up and all of those signs. I've seen as much as ticket hawkers hanging jackets on the signs to cover them when they're low. So a sign like the DOT sign, if we could get it for any amount of time, is quite clear.
We're happy to ask for it 100%, and they,
Can you tell me, is it
summer?
traffic? I'd rather have it 24/7. Is it traffic enforcement who would deal with the hawkers who are pulling cars out?
post over there would try to deal with them as much as they can.
Because there are two hot spots, one over by the Staten Island Ferry in the bottom of the FDR and the
Right.
other one at the bottom of Lane A.
Right. I know what you're talking about, yeah.
Thank you. I'm not gonna mention the other things because I know that we have 50 people here and we'll talk about the other stuff. So
Okay.
You said there's a task force. Can you talk a little bit more about that?
Yeah, we, like, when I got to the first, I realized there's certain areas that are problematic. We had issues at Fulton Street, we had issues at Battery Park. In Tribeca, there were certain places like, Dwayne Reed, 250 Broadway, 205 Broadway.
Target.
Yeah, all these locations were having a lot of problems, a lot of larceny, some shoplifting gone bad, a lot of people being harassed over there. So we set up people that were gonna be in that area so they can respond quickly. And it's worked, the response times have gone down and the number of apprehensions have gone up. So that's what we're focusing on.
Within the first.
Within the first, yeah, it's all,
I walked into CVS on Fulton and Nassau yesterday, and there were two officers standing at the front door.
yeah.
I was so pleased to see
Yeah,
that.
I walked in there a couple weeks ago and the candy aisle had candy in it. It was great. So,
It's great. Any other questions? Anybody online?
I know that the crew is here for the next topic has questions that relate directly to NYPD. And I'd appreciate if we asked NYPD now while they're still here, so we can be topical and timely for them.
And we only want to go another like 6 minutes, so if you have your questions, shoot them now.
And if anybody's online with hands up.
Do you want to ask about the mattresses?
No, go ahead, raise,
Specific.
I apologize.
Sorry, what's up?
Name,
Name.
introduce.
Introduce yourself.
Sure, sorry about that. Joanna Faith Williams, and I'm with Bad Eye West Association for Greek. One of the questions that I have is, just curiosity about trying to understand, all the emergency vehicles that end up being in front of the shelter and just we're seeing it all times of day, like early in the morning, and then through the night, and we're glad that people are getting the help that they need, if that's the case. But, curious, I guess, like, should we be concerned that there's, like scary issues or like something that could become dangerous?
not usually. A lot of times it's, it might be just somebody who's sick there, who needs an ambulance to take them to the hospital. It could be, if you've seen a police car there, it could just be in the area because people have expressed concerns and they're just there to be a presence. So just because you see those vehicles doesn't necessarily mean something, is going on at that particular time that you need to be worried about.
That's encouraging to hear. I just think like sometimes we'll see like multiple cars that are there with their lights on and we'll see several officers having to stand, like just going in and out. And at one point, people with SWAT gear or whatever it was called.
I think you're talking about,
Yeah,
like those plastic shields.
something
Right.
like that.
Yeah, that's just procedure. Anytime we go for certain jobs, and most times it won't turn out to be a very big thing, but it's better to have it and not need it than need it and not have it. So we go in and have certain things, but it doesn't mean that everything's going crazy necessarily. It's just we have our equipment there in case we need it and
The bulk of the 911 calls, to 105 Washington have been like for emergency, like for medical services. Yes, there's been disputes there, but I would say more than 50% of the 911 calls have been for, hey, this person's sick, we need an ambulance. That I'm assuming, maybe the shelter can speak to this more directly, but I'm assuming whatever medical condition that person's having, they can't handle it there, so they call 911. Sometimes those 911 calls prompt, not just an ambulance, but a police car to show up too. We show up, we go there, and, if we're not needed, we'll leave. If we're needed, we'll make an arrest or we'll diffuse a situation, but.
there hasn't been a lot of that there. There hasn't been a lot.
Introduce yourself.
I have a two-part question for, thanks for coming. So one, with the migrant shelter closing in March, what role will you guys be playing in that transition? And then once the shelter closes in March, does that change the presence that you guys will have in any, recognizing it's still a very quiet, short, low barrier shelter and
Just speak just a little louder.
there's still the low barrier shelter and then there's that abandoned lot with a lot of blocking the street.
There'll be less calls for assistance, maybe a little bit, with one less shelter, so we might not be there quite as much, but we'll still have a presence for the reasons that you're speaking of. There's still the other shelter, and, whatever other quality of life issues come up that we need to go there and speak to or address, we will.
So someone over here, introduce yourself.
I'm Brian Fisher, and, I guess I'm just curious, we're talking about specific targeted, like, retail task forces.
Mhm.
I can almost guarantee you, I have some data from my neighborhood in like 5 or 10 days here when it comes out. that you're gonna notice an incidence of, like an increased incidence of crime and or like police responses in our neighborhood due to, I think among other things, the homeless shelter, possibly the migrant shelter. I mean, we don't know exactly where it comes from, but I would be willing to bet in 5 or 10 days here, we see a large increase, in activity and responses in the neighborhood. So my question is, up until now, we've basically had no ability or response from the community board or the NYPD to like increase security in the neighborhood. And the shelter operator basically just says, it's outside our doors, we can't do much, which, that might be true. But I guess my question is, what can we do, like, if the numbers do come back looking really poor for our neighborhood, to increase, security, make us feel a little safer, and, begin to tamp those numbers down a little bit?
Were you here when the captain read the statistics for the community?
Yeah, year to date for 15 days, I mean,
Yeah,
Sorry.
we can do directed patrols at the location, we can do community visits to the location. If you have specific concerns at specific times, we can look to those. We have neighborhood coordination officers, and each one of those neighborhood coordination officers have a specific area. And when you contact them and you're in their area, they'll go to the locations that you're talking about at those times, and they'll see what they can do to address your concerns. I mean, the task force, like if there's a retail theft task force, they're dealing with a criminal issue. There was a crime committed, they make an arrest. What you may be talking may not always be that. So it may be a summonable issue, or it may be something where you're gonna try to offer services. You're gonna try to do some sort of a cleanup, which goes through a whole process. So there's different things that we would need to do depending on the situation. And I would suggest if you have an ongoing issue that, Nick can speak to you, after, and he could put you in touch with the officers that are part of your area, and they can develop a plan going forward.
thanks, yeah. We'd like to open that dialogue, I think.
Yeah,
Just a little bit more than it has been.
Absolutely.
And any data we can use to get more officers will be amazing. I mean, from day one, since he got here, I've been telling him about the little Eye West area, and like, we've been doing directives there. I mean, me and Mike were down there probably every morning, just swing by, just take a look at what's going on. So we are there. There's also the counterterrorism, the World Trade Center Command is in there. Again, it's not with lit up and bright lights, but there's cops there. There's always a police car there. The CO actually turns out of there for the World Trade Center Command. So, I mean, we do have a presence there. I get it, sometimes a lot of these quality of life things creep up on us. But like if we're always talking and you're always able to just shoot me a picture or an email or something, we could try to direct some of these resources in that area. I know, like, we just got 9 new officers for this new academy class, so that's a big.
9.
Oh, so they're deployed to transit, so, so like, we're also strained with what's going on citywide. So I was excited for a minute, but.
Right, so we need a transit system.
Well, we're constantly looking, we have good communication with the whole group down in Eye West, the last few months, so, like, send me pictures, we're trying to address it. I get the calls from the restaurants that are down there, there's a few that are still left over there. And we'll try to work it out. I think there's some good news about the 99 Washington Street closing. I haven't had confirmation of that, but if that's true, so we're slowly going. Okay. All right, so we're heading in the right direction with that
We're
respect.
pretty concerned about what's gonna happen with that, though.
So Whitney asked what the transition is between when the shelter closes into when it becomes maybe a hotel again, but you don't know, obviously, like.
Yeah. Listen, we're
not.
gonna be here for you guys. It's not like the police department's not gonna run away. If we have to be there,
We
we'll
would
be
love,
there.
we would love to get an answer ourselves on that. That answer can only be given by the developer. Because what the developer chooses to pursue, hotel rates right now are at the highest that they've ever been. Tourism is back beyond what it was pre-COVID. So ideally, the opportunity will be for him to be able to make money and reopen it as a hotel, which supports the businesses in the area, which is really important for us.
Because I'm wondering what turned into a homeless camp within a few days.
Absolutely, but again, it's up to the developer. We actually private property, so there's nothing that any of us can do or say. We're just, kind of fingers crossed that he reads the news the way we do and he goes back into tourism.
All right,
I think
so-
a hotel is actually.
All right, I'm sorry, everybody. We'd like to get on to the next topic, so if there's anything else to ask, go ahead.
Sorry, just one thing to,
Please say your name. We
Oh,
got away from that from cross conversation.
sorry, my name's Regina, I'm a parent at PS 150. I have a 5-year-old and he plays at the West Thames playground very often. Oh, so I have a 5-year-old who plays at the Thames, West Thames playground. And a few months ago, not even a few months ago, maybe a few weeks ago, him and his friend, while exploring the playground, found a used syringe and broken glass. And then now I hear that when it was a little bit warmer, I have friends at the 200 record place that directly faces the playground. And now they're seeing people having sex in the middle of the night in the playground.
I
So
hate to tell you, that's been happening since the parks were open, so.
I've been hearing about it more recently, when it was a little bit warmer. So I just want to know if there's anything like maybe
Well, one thing I would stress is when they see that, they need to let us know. I wouldn't, if there's no 911 call,
Right.
It's also calling the ambassadors because they're literally at West Thames Park,
Right.
literally right there. Their office is there. All they have to do is trip out the
Downtown
door. And so, not the downtown line, the Battery Park City.
I reported it in Battery Park City, that little office.
Yep.
Oh, it's
Not sure what happened to it after, but then, sometimes parents get busy, but I just wanted to communicate here that, kids, once summer comes, they're barefoot. We do not wanna, one accident is already known with needles, with kid's foot. So I wanna make sure that, there's like some kind of monitoring around there, because this has never happened before.
Do we
The
know
needle
who's
part, that has
responsible
never happened.
to clean that part?
Battery Park City Authority.
We just speak to them as.
Battery Park City Authority, by the way, just as an update, is going through an RFP for their security for the ambassador company that they work with. And so I highly recommend members of the public send not just the complaints, but what they'd like to see to the Battery Park City Authority and copy the community board, because we're advocating to include additional things in their contract. They used to have an SPO program that they worked with NYPD, but again, there's lack of funding on NYPD to be able to train the SPOs, special patrol officers. So to be able to take a ambassador, who's the private security that the Battery Park City Authority has, and allow, they should be able to give summonses, for example, for things, and to have a greater sense of staffing and enforcement and coordination on a variety of topics. So take suggestions, send them there, copy the community board, because we're gonna be asking for those things to go into the RFP.
I want to encourage you also to go to the Battery Park City, the Community Board's Battery Park City Committee meeting and discuss that. And then for everyone, I want to encourage you to come to the First Precinct Council meeting, which is the
Last
Thursday.
Thursday.
30th.
This month it's
30th.
the 30th, 6 o'clock at the precinct.
And just back to Battery Park City Committee for a minute. The next meeting is on the 6th of February, and they will likely be discussing security at that meeting. So if you want to come to that, talk about that, that'd be great.
So I'd like to thank our officers and the captain. Thank you.
On what?
And if you have more complaints, like I said, First Precinct Council meeting, okay? We're gonna move on to the second topic. Thank you so much.
Thank you so much for having us, all right? Have a great night.
Thank you. Be safe out there.
So those, this is Mariama, she's the co-chair of Quality of Life, so
Thank you.
she goes in her chair and I move around.
So now the next topic on the agenda is 105. You have a hard out at what time?
7:15.
7:15, so we gotta move, okay? So did you want to do a presentation or say anything?
Y'all want some?
And introduce yourself.
Hi, I'm Brooke Venegas. I'm a Deputy Chief Program Officer at CUCS. I work very closely with Paula, who's the Program Director. What is it? Oh, I'm Paula, the Program Director at Washington Street St. David. Just to get introduced our CUCS crew quick.
Daria Morgan, COO and General Counsel for CUCS.
Hi, Dina Barbosa, Chief Program Officer for CUCS.
Yeah, so we're happy to be back. I'm sorry.
Did you want to?
Yes, sorry, we'll introduce DHS.
Hi, I'm Jim Markowitz, Deputy Commissioner for Intergovernmental and Legislative Affairs at DSS.
Hi, I'm Tracy Batar, Manhattan Borough Director for Intergovernmental Legislative Affairs at DSS.
Thank you. Yeah, so we're happy to be back. The last time we were here, I don't believe we had opened yet. So our shelter, the Safe Haven opened September 23rd. So we can give a little update about how it's going since then. We are, and also there may be people who don't know who we are at all or what our shelter is, so I can give a brief overview of that. So Safe Haven is a 84-bed Safe Haven working with men and women who have chronic street homelessness. They're coming to us through a referral system through the Department of Homeless Services and street outreach teams who are working with them and doing a screening and referring them to our program. A lot of the clients who are referred to us do not haven't had care or psychiatric care, and they have a lot of needs. So our program is able to offer on-site psychiatric care and medical. Really intensive case management services. So we do medication monitoring, money management, help with supportive employment if that is what they're interested in. But some of the real basic needs are just, what type of clothing might they need when they come in, and being sort of seen by the medical to see if they have anything that needs to be addressed. And the ultimate goal is to help them move into housing. And we have had a success in having our first client move out, and we have many more in the pipeline. So that's really great to see. And we are at capacity. So we have all 84 beds filled with people who need them. And we formed our CAB, so our Community Advisory Board, and we've already met twice. And we're meeting every other month. And I do want to thank the community too, because there's been a lot of donations and support around helping with things the clients may need. So we had Open Hearts Initiative has done things at our site. Also, the school did a book drive and donated lots of books, and Stacy was kind enough to haul them all over to us. Thank you. They're much appreciated. And then also we've had donations from residents at 50 West. So just appreciate all of that. And yeah, so I think I may have missed some things, but
I would just add that it's 24/7.
Yeah, it's 24/7.
24/7 security staff and social service staff.
yes. And we do on-site groups. Paula runs a community meeting every Monday with the residents and talking about, what are some of the positives that have happened? What are some community issues, coming together as a community, problem solve things, but also addressing things that we may hear from all of you in the community about how, what our good neighbor policy is, and trying to reinforce all of that. So there's always good communication going on between the staff and the residents.
Just wanted to add one more thing, and that is through the CAB process, just feedback from you all. We tweak things as we go, we improve, we're sort of in a Kaizen place always. So we've been working and monitoring our hotline. So if you don't have the hotline number, we have fact sheets. And I believe that we can also email them as well. I think they've already been emailed, but we've been looking at, calls that we've been getting, response times, monitoring them, and different ways that we can respond. The fact sheet has the hotline number. It has cell phone numbers and email contacts for Brooke and Paula as well. So
24/7 numbers, right?
Yeah,
that's the hotline number is a 24/7 number.
the hotline is the actual direct number to the Safe Haven. So there's security staff who are working in the booth and can redirect the call to a staff member. Plus, in the fact sheets, which I do have here, if people need, are Paula and I's contact information.
So there were a couple of things. I don't know if it was at the CAB or this last meeting here. Someone brought up that they had called the hotline and there was no response, so has
Yes.
that been addressed?
Yes,
Yeah.
definitely. Mhm. So, setting up the voicemail, making sure that security understands, like, so if you call and you get the voicemail, it means that someone is on the phone, the security is, taking a phone call. So training them to make sure that when they see the light, that they need to check the voice messages and make sure that information is getting to the CUCS staff that are working so that they can address it. But yeah, so mostly a training piece on making sure that they are manning the phone the correct way.
We can also monitor the number via email, for lack of a better word, so so voicemails can come in on email, so we can actually take a look as well to see if something's not been opened or something, we're just, has been sitting there. So that's another way that we've been looking at things.
And then, I'm sorry, and then I was gonna, since, unless I'll take the opportunity, to keep going. Since, Esther's
Yes.
complaint about the noise on the patio, has that been addressed?
Yes, so it's a quiet zone 24/7 and it closes at 10. And if people need to go out and have a quick smoke, it's a very quick thing and come back in. That way we don't have people on the roof or
Well,
out.
that is now for winter, they're gonna run out and have a quick smoke and come back. What's
Yes.
gonna happen in the summer?
Same thing. We have a security guard on the second floor and there are staff, monitoring that situation. And we actually have key card access if we needed to just like lock it off and have the security only let them out and come in.
So in the summer, what are you gonna do about it though?
Same
Um,
thing. Then
no,
if
no,
we need to
but I-
shut it down, we shut it down for them if they
Because
can't
there is
follow
still
that
the
rule.
6-floor space, so,
Yeah.
the 6-floor space is larger and it's got that enclosure. It just seems that especially since we opened in the fall and now we're in the winter, the quickest sort of out seems to be that second floor, and then you're right on the lounge too. So we had a guard posted on the 6th floor, we're seeing more activity on the second floor. So we have a guard posted on the second floor, we're monitoring it, and as Brooke said, if we need to just shut down headsets and probably divert folks back up, then we'll do so.
I haven't heard from Esther, so I assume
Yeah,
it's okay.
we will keep in good touch with her.
I'm sorry, Mary Ann.
The improvement in residents from lower Manhattan streets within CB1. I think the last time you were here was like less than 50%, which is troubling.
So in the cab, it was 48%, from I think we were doing 14 streets south, right? And we have been at capacity mostly, so we've only had a few more referrals. Information, and we'll be sending that
Do you
out.
have CB1 numbers, not just 14th Street South?
That's how we had discussed doing it, regarding the 14th Street down, so,
Who's the we?
in our cab meeting, it came up that way.
But I just also wanted to say something that Brooke is answering on behalf of CCS. She doesn't control referrals.
Yeah.
We get referrals from the citywide task force. And so I do want, there's a local preference, absolutely, for folks who are from this area who want to come in. But I do understand that if there's a need for capacity and there's other folks from different areas who want to come in, they will have a bed. And so,
Not
yeah.
expecting you to send
So-
anybody away, but if you're providing services in our community and the people who were unhoused remain unhoused in our community, then it doesn't do us a service. So
I think
that's what I'm
that,
trying to get to.
I think that we have our city partners here
Yeah.
to speak to how referrals are being handled and outreach teams who are actually, looking to bring people here. I know outreach teams here are active, but we also know that it takes multiple contacts. There's a back and forth process before people will actually come in. And even when they do come in and stay. In the meantime, those beds just can't lie empty. So there might be that effect of turnover and so forth, and possibly a delay with folks who are being engaged. I can't speak to the entire process. We are the service provider. We're not the referral organization or the system that controls referrals.
I want to make one quick comment. We are opening up a new safe haven around 14th Street. That should be open up next month, no later than March. And so that will take some of the people from around 14th Street, a little higher. They will be going to that safe haven. So it will free up space for 105.
How many beds?
I believe it's a 108. Yeah, it's 108 beds in that safe haven. So that's a good thing. It's coming. It was supposed to open up in December, but we had a couple little hiccups. So it will be opening. So that will be more for 14th Street and a little further.
And it's also co-ed?
Yes, yes. It is,
I didn't hear the question.
14th and where?
it's on, is it not even rolling?
Where?
It's on,
You get back to us.
it'll get back to you. It'll
That's
get
helpful.
back to you.
We just wanted to give.
Yeah, so that'll free
If
up
we're in the
space.
twenties and the thirties in terms of percentage from our district, I mean, it's
It's
just.
not your district though. I know that for a fact. The new one is coming. It's
No,
not-
no, no, I'm just saying, what we've been, to this point, that means that we have at least, 70% of
Mhm.
our unhoused remaining unhoused. So that's what the question's coming from. It's not, to attack you for helping people from other areas, but we do have a need here that we need to get to at some point somehow.
I think the other,
That's all.
the other point to make is that, and we've made this point before, is that individuals who are street homeless are transient. And so they're not just below 14th Street, they're moving all around the city. And so where we identify them at doesn't necessarily mean that's where their home base is. So they could be technically, residing on 14th Street, but getting medical services on 59th Street and have community connections on 59th Street, but have their comforts in other, they're basically located below 14th Street, but they're where they go to seek services is above, 14th Street.
Okay.
Sure.
Thank you.
Committee first, committee first.
Just a couple questions. So you said, you made reference to whether or not
Sorry,
people,
could you identify yourself?
He's a board member.
Oh, I'm
So-
sorry, I just don't know everyone, so I
Yeah,
just.
no worries. That's a good point though. For
Jared.
people who are new to
Hi.
the room, that would be great.
sure. The first question was, you referenced that some people accept services, sometimes it takes time. What is the average stay that you're finding so far? Are people, is it?
The average stay inside the facility?
Yeah,
Before, just to clarify, we were referencing it takes time for someone who's on the street to accept the offer to come inside. That's what we were referencing.
right, but what I'm saying is that doesn't necessarily
Once
last,
they're-
right? So are you finding that people are embracing it and are staying there for stretches, or is it in and out type of thing?
Yeah, I think there's a good amount of people who are sticking around and staying. And then usually for us to be able to help move them out, it can take around 6 to 9 months to do that.
And-
6 to 9 months,
To move into.
Into like housing. Sometimes it could take longer depending on what they,
their needs are.
what they need, or shorter, yeah.
And can you talk about what the referral process looks like? So if people see somebody's unhoused on the street, is it 311 based? Is it emergency call based? Like how's that work?
I think it's a combination of both, and it's a combination of our outreach team being out in the street, seeing constituents who were homeless and needed assistance. And like they said, it's touches. They go, they see, they talk with them, they try to convince them to come in. And then when they agree to come in, then the referral is made to that's not the only safe haven, to 105, but we have other safe havens around the city. And they ask also the client, what's their preference. So if it's someone down here, their preference it may be 105, but say they might want to go to Brooklyn. So they'll reach out to see if we have anything in Brooklyn. They might want to go to the Bronx. We'll reach out to see if they have anything in Bronx. I have the address, it's 91 East Broadway. So that when that opens up, that's gonna free up some beds. And we're gonna try to, keep people who come in. The outreach teams will send some people from that area there. So 105, we can focus more on 105. But like we said, like Darius said earlier, it's about the need. We don't turn anyone back. If someone needs shelter, we provide shelter. And if 105 has the bed, we have to use the bed. But we try to put people in the areas that they are familiar with and that they want to go. And if someone's here in this area and they want to stay in this area, we'll try our best. Because it might be someone in 105 who might want to go to another area. They can switch it out. So
Just to connect the question that as far as what the community can do to connect the dots, if they see somebody in their neighborhood so that this person is even on your radar, so they can get access to these services, it's 311, it's through the app. It's
311.
Did everybody hear that?
East Broadway,
91 East Broadway.
so that's in our.
No, it's not.
No.
No?
No, it's not.
East Broadway's Chinatown, is CB3.
Mm-hmm.
Okay, committee?
Just to follow up, when you encounter a street homeless individual, you call 311, that initiates the process, the outreach team goes out. And then if the person is willing to accept services, then they make the referral, sometimes to the Bronx, sometimes to the CUCF, Safe Haven. But it initiates with you making that initial call to 311.
And multiple submissions spark multiple outreach typically.
Typically,
Because, you know, there are people in all of our communities that you see on a regular basis, especially as it gets cold out.
Yeah.
Just curious how that.
So we try to send out the outreach team within 2 hours of the call. So if you call multiple times, there'll be multiple teams to go out.
Is that 7 days a week?
Yeah, 24 hours. We're even at night. But like I said, it's touches.
Sure.
Meaning, like, a lot of them don't want to come in. But now with the weather getting so cold, some of them are agreeing to come in. So that's why, 105 is full and some of our other places are full. So we have a couple of new ones opening up across the 5 boroughs, well, 4 boroughs, let's say.
So multiple submissions equals multiple touches.
Yeah.
Yeah.
That's good to know.
And there was a article today on the news that the mayor is going to try and push to have more safe haven shelters open.
Yeah.
600. 600, that's expensive.
Diane?
When somebody calls 311, do they want to know an address? Because if somebody's on the street, you say, oh, it's on like whatever, Duane and Greenwich, but you don't know, it's like, is it, 300, whatever. You don't have a street number because they're out on the street. They're not in a building
Yeah.
necessarily.
I mean, an address would be ideal, but if you give a relative proximity where the person at, that would be helpful as well.
And the description, right? A description on that.
Can I ask a question from DHS? Do you have you received any, seen any dialogue, or been in conversation with anyone about alternative sites in CB1, including not limited to 52 William?
To my knowledge, no.
You asking me? I'm low on totem pole.
Just including you two.
No.
So I would certainly love appreciating if you could reach up to Chris Gonzalez and ask that same question, whether they have, Max?
Yeah, I can add quickly on that. The council member had a meeting with the DSS commissioner last week and asked that question, and she told him no. And
Okay.
it's on the member lead.
I'm sorry, what's the no, man?
What's the just
From the commissioner.
No, but what's the no?
Oh, no to any, no, there's no discussions or plans for anything. And
Do we have any updates as long as you're here? Could we, after the end, would you mind staying after we finish this topic for 3:20?
Good, thank you. Committee? Not, I'm opening it up to, yes, John?
Yeah, well, I noticed this man, as I walked here today, and it's cold out. So when, do we, enforce that it's too cold for him to be out there? Next week, they say it's gonna be single digits. And the guy, he's sleeping there all the time. When do they, do something that he's not in the street when those times are cold?
Well, we are not allowed to force people to come inside. We can't pick them up and grab them to come outside. That's against the law. So he has to want to come inside.
And wonder, Tracy, if the question is, so when do we call cold blues? Which are
Yeah.
decisions, right? So it's health department technically has the authority, OEM
When it's
provides support, NYPD, and then DHS as well. So I think the question is, I can't speak to whether or not you might know more about when code blues are actually coming down. But typically, when you're below that freezing point, code blues are called amongst the joint agencies. So
What does that mean specifically?
32.
Below 32 degrees.
No, but I mean, they force them to go inside?
No, it opens up the shelter, for individuals, so they don't necessarily need to go through intake. They'll just be able to, go to shelter for a temporary period of time until the cold blue is over.
That's not the safe havens. That's just the general sort of shelter system.
The general shelter, if there's availability in safe havens, plus drop-in centers as well. Plus the city has a number of warming, buses, mobile buses, and we're working to set up a warming, center for.
So let me just ask a question then, because if, obviously if it's that cold, people need to go inside if they have the opportunity to, but if you're talking about there not being intake, then how do you ensure that people who are sex offenders, for example, are in that part of work if you're not screening it at that point?
So it's meant to be temporary. So if it's a cold blue, it's typically for one night, the cold blue is over. And it could be an extended period of time, but the individuals are, once the cold blue is over, they're screened appropriately and then placed in an appropriate shelter if they decide to go into shelter. But for the emergency state, and to get the individuals off the street and to prevent them from having a health hazard, they're placed in shelter where it's warm and they can get services.
And I just wanted to add, I mean, Brooke and Paul can also speak to their experience of code blues as well. But typically, even during code blue periods, when folks have come in, and this speaks to my experience when I was at DHS, we've got folks being escorted in by police, by outreach teams, by other sorts of coordination. They're coming into primarily drop-ins, warming centers, and then shelters, and yes, safe havens. But I've seen more people move into drop-ins and warming centers and so forth. And so even during that time, the idea is to get them in off the street, but there are still those teams working to get information from them and doing what they can to really identify them so that we understand who and what is where. Because the goal is that if they have to come in, you know who's coming into the best of your ability. You may not have had the same extensive screening, but you're trying to get information. Ideally, when the code blue is over, as Jamar pointed out, you can then actually get them to an appropriate shelter or an appropriate facility. So you're taking advantage, maybe the hard word, but you're using the time to actually try and service the person aggressively because it's an emergency. And so you're just using the emergency to actually maybe get through the person.
Right. Okay.
If the committee doesn't have any more questions, I'm opening it up to the community. Committee? Okay, 2 minutes, everybody. Who wants to go first? Somebody back there had their hand up.
I'm happy to go.
Yeah.
I'm Stacy Burt on the cab, and one of the things we talked about in our meeting, and this may not necessarily be broken for a team at DHS, is the data tracker. We would love a little bit more information on where individuals are coming from, specific referral location, why they may have denied a bed, if they denied a bed, where their approximate location is. It's a request that we had in October and December, and I think it needs a concerted effort between all parties involved, but just understanding why we haven't received that, if we will receive it, you know, what the holdup is.
Is that a HIPAA violation or privacy rights violation to provide that?
We've only.
Streets, no one from Streets is here, and they provide that information. So we can get back to you on that. The next cab is when, this month, or next month. We'll definitely try to have that data for you. If the data could be given out,
Can you share that data with the community board so we can share it with the community? It's anonymized data that it's not looking for, hey, John Doe refused to bed and went to here. They're looking for, 75 people showed up, 20 refused to bed, 10 decided they wanted to go uptown, right? Do I understand that?
Exactly. Anonymous. And then follow-up question is, and this relates to like, this is the street team who has the data, it's DHS who does the referral, DCF is running the shelter, like, how can we be made sure, like, how can we be sure that there's an effort between all the parties who are there to capture these people so no one's falling through the cracks? It sounds like there wasn't even a conversation with the street team about this request, and we made it almost 4 months ago.
no, Streets was on that call, on that cab.
Okay.
We always have someone from Streets on that cab.
I don't know who the representative was.
Someone from Streets is on that cab. We always have a commissioner was actually on that cab. So like I said, I'm gonna look into this and I'll get back to y'all with some answers, definitely by the next cab.
I think I would also add that there are systems I mean, we're required to enter into, outreach, so our outreach teams are required to enter into, a streets solutions application. So there's an application when you're in shelter that actually has client information, tracks client information throughout the shelter system. It's the case management system, called CARES for shelter folks and safe haven folks. There's a similar application for street homeless uses, and then agencies also have their own sort of application. So it is not uncommon for people to actually see information about a case or a person there. It's not as though they're unknown. So we work really hard to get people to come in. But as we discussed, I think many months ago, the average of something like at least 7 contacts initially to begin to actually sort of break that barrier. It takes repeated contacts over and over again to get somebody to actually agree to come in. And then you have to continue to follow up because they could be referred and then come in, not come in, and actually come in and stay. So it's just a repetitive, sort of tenacious process where you're not really giving up on the person.
Of course.
Yeah. But you know, and of course, this is all regulated. But there is information that outreach teams are actually have about clients where they are to the best extent they've got identification information.
Yeah.
But we do have that. There are systems.
I need to move on to the next person. Sorry. Next. Yes.
Hi, as you mentioned, from Fire West, and could you please elaborate a little bit on the process and the responsibilities when somebody is brought in from outside of our local neighborhood, then refuses a bed at the shelter and ends up staying in our neighborhood on the street?
So if we know about it and the client is outside of our building, we work with the outreach teams continue to work with that client and try to encourage them to come indoors, whether it be back to our shelter or to another one. We did have a situation like that come up in the community, and a client came and she didn't want to stay indoors because she said she was looking for her husband, and she stayed outside. And like Paula, myself, other staff went out and outreached her and encouraged her, just come in, take a look, like try to get comfortable, just come and have a meal and try to adjust to being there. And the outreach team continued to do the same thing, and she was willing to come indoors within a couple days. So that's our goal. Like, we don't want them to stay outside. Just trying to continue to give them services and help them be able to overcome whatever obstacle it was for them to come in.
That's. No?
Oh, I know that.
Right. Two-pronged question. Some of this stuff we talked about at the cab, but I think it's a start by introducing yourself.
Oh, Colleen Wakey, by West. So 2 things. Number one, I think there's a little bit of a misunderstanding about what actually happens when there's somebody bedded down on the street and what it means relative to the safe haven, that you guys don't come out and actually communicate with the person on the street. Everything has to go through street referral. I think that that's something that wasn't clear to the community. So what is the protocol? We call 311. 311 oftentimes doesn't respond for like up to a 48-hour window. So if somebody's bedded down, you guys know better than anybody, right? They're transient, and so we're kind of chasing them. We did have 2 kind of distinct community impacts since the opening of the shelter. One is persons who were relocated, reduced sheltering, as you just discussed, and bedded down, hyper local. I understand you're not responsible. I understand that you're still trying, but the reality is it has a significant impact on the community. And so we want to understand what agency is actually responsible for that, because the goal was to reduce local street homeless, and we've actually seen it up. Number 2 is adjacent to the shelter. We all, I think, understand that there's a site that's in development that's now stalled, right? And they're in foundations. And so there's a person, I don't believe that they were affiliated with 105, but they were bedded down for days, including a mattress. And I think it was actually a week or so. I don't remember the timeline. And many members reached out to the shelter, reached out to 311. We were directly reaching out to 911, to the community officers. And it was like a round robin of outreach with no tangible results. I think actually it took a call to the bid to finally get somebody to come and, because the person wasn't on the mattress and have the mattress removed, so it seems like we're just like in a circular reference. What is your recommendation so that we as community members can advocate for ourselves better and help that person, but also not have the sanitation issues?
Yeah, that situation actually resolved, and it was a collaboration because I think Paula, you even went out there, right? One, we went out to see like, is this somebody that we know? When it wasn't someone we knew, we asked them if they were willing to come indoors. We made 311 calls. I think we actually had to make a 911 call, but we felt like he had some medical things that were going on. And then we looped in, the downtown Goddard team that works in that area. And they came out and tried to engage him too. And I know that he was moving the mattress around, and I think that was part of the reason why some of the 311, like being able to connect, wasn't happening. But I feel like we were able to coordinate and follow up. So we do want to know, like, if something like that is happening locally, like we can't be responsible for it all, but if we can come out and try to see if we can make connections, then we're willing to do that. And so he's with us. So
He's currently at the site.
Yeah.
So, I mean, I think that just emphasizes that it will take time, right? And so it literally, when we think about just the hours involved between our staff, between outreach staff, between city coordination to get this one individual to come inside. It may seem like round robin on the outside, but there are a number of people that finally had to track this guy, trace this guy, your calls, our calls, in order to get this person to come in, because unfortunately, and well, not unfortunately, we cannot pull this person off of the street. We can't order them in, unless, which is why when Brooke saw that there were medical issues or other issues where he could be a danger to himself, she then used a 911 call and so forth. But this is unfortunately what this is like. We all do the very best we can. This is not someone that was a referral per se. This is just someone who's there. And so we're able to intervene. It took time, which is one of the things you deal with when it comes to street homeless individuals and outreach. It does take time. We do, on our side as a provider, coordinate, whether it's 311, whether we can actually coordinate with our own outreach team as part of the mock. Pretty much what I can say with respect to that. For those who refused or who didn't want to go through with the referral, move from referral to intake. I know the two cases that we had, one in which we actually got the person to come in. Another one, we actually had outreach sort of follow up with this person based on what we knew about where they were frequenting, to actually, so that no one is falling through the cracks. But again, it just takes time to really get someone to move from the street back inside.
I think those are the only two examples that I know of that happening. Yeah.
Well, someone put it out.
Introduce
Oh,
yourself.
sorry. Ryan Fisher. One evening was very concerned for that individual who was out on the street in oncoming traffic on the mattress. So I called 911 and sat there for an hour trying to get something to happen. There's an individual in harm's way. Yes, they put themselves there, but it's, still, I would hope that NYPD would show up, and instead I saw a sheriff arrive, sort of glance and just pull past. So I'd love to delve into that, but that mattress then was also found a day later on the roof of 109. A new couple had taken the mattress and broken into the building next door, so, and you can see why we're concerned, I think.
Yeah, this is not a person who was referred to the site. This is just someone who was street homeless, right? So I think there's a question about what are we doing about, what are the issues with street homelessness writ large? We have our role in the process and how we interact with the continuum. And we did hear about this, another group then taking this mattress and so forth, but they weren't affiliated with the site. The one thing we can say about that person who was out there with this mattress is that person did come inside. It took a lot of concerted effort. So I just want to make sure that we're distinguishing between, people who are referrals or clients and people who are not.
I know we're gonna have people who will raise their hands online, so I just wanna be mindful of that. I know you keep saying it's 7:15, but the answers are long a little bit and repetitive, so I wanna get to more of the public if you don't mind.
Is there anything on? No.
They will raise their hands. They're listening.
If you're listening and you have a question, please raise your hand. Anybody else in the room while we're waiting? No? Nope, nope.
Really?
Wow.
Shocked.
I know you had a
I'm
list of
shocked.
questions, so, you know, we have the opportunity, everybody's in the room.
Go ahead, go for it.
Go ahead.
I just would love to get your, commitment to showing up to the precinct meeting on the 30th.
I mean, I think we're gonna need to look at that and evaluate it. We have a cab, and really that is our primary way of interacting with
And coming here.
and for the shelter, I mean, I think that just attending the precinct meeting, something we're going to talk about with our, with CHS, CHS, and really determine whether or not the way forward for that is.
And there is representation from NYPD on the committee.
Exactly.
Yeah, so that's the other, to like.
Who's the representative for your group that's on the cab?
The two gentlemen
And
over
then
here.
the neighborhood community officer.
Nick.
No, I'm saying for the Fight Eye West group, who's the representative on the cab?
Colleen.
Yeah, so you're reporting, you're telling them what's going on, right?
Sure.
Yeah.
That's why they're here with a list of
Right.
questions, because they're followed.
We have one person online.
One person online?
Catherine.
Catherine, unmute.
Jason.
Jack will unmute you.
I'm Catherine. I'm in Videye West. I had a comment and a question, and this I know probably can't be answered completely tonight because you said it would be something you would come back to at the CAB meeting. But as far as that tracker, a lot of the anonymized data I would think should include male, female, how long they stayed, how many people actually moved into stable housing and after how long. And I'd like to see, if possible, how many unhoused people have been marked in the community. I've been in the neighborhood for 20 years, and it's definitely, I've seen more now since 52 Williams first opened and 105 than I've ever seen in 20 years. That's my comment. Additionally, I'm curious about the screening. There was a lot of, like, what exactly does the screening entail? I know you mentioned where they want to go, what kind of shelter they should go to, but then there was another comment about screening for sex offenders. And I remember from the call like 4 years ago that it was stated that that's not something that necessarily disqualifies. So I'm curious about this various screenings that take place, and if any of that screening involves checking someone against a sex offender registry.
So we've actually addressed the sex offender screening process multiple times. Every single time that we've been here, all the walkthroughs that we hosted, and we also addressed it in our fact sheets. And the sex offender screening also relates to basically enforcing residency restrictions. So I'm going to refer you back to our fact sheet and back to our previous statements, because we've addressed it not only once, but multiple times in the entire, every single time that we present and every single time that we come here. Basically, the city does its screening to determine whether or not they have a residency restriction and are not permitted to actually be in a shelter that qualifies to the 2 block radius of the school. And so it's whether or not you're level 2 or 3 on parole or conditional release. We actually go through that and outline our process in the fact sheet. Their question that came up was what happens during a code blue, which I actually responded to as well. Which is a slightly different scenario because that's an emergency situation and it's a temporary situation. And so I think that's going to be just a response on the sex offender question. Again, we can refer you to the fact sheet and the previous answers and the walkthroughs and the presentation. With respect to your data request, we do hear it. I do know that our city partners are working through to determine the format for what kind of data we're going to actually provide at CAB meetings and so forth.
But the movement data we provide.
Yeah, we have been.
Permanent housing.
We have provided, we've provided placement data, we've provided, we've indicated where, we've basically indicated what I'm gonna call capacity data, who's in, breakdown by sex, placement data. We've done actually origins data, which is what actually led to the question of where are people coming from? I think there was a request for further drill down. Are they coming from CB1 specifically? Where in CB1? And that we don't have data, we don't manage the system. Where people, with respect to referrals and what happens after, they are not with our system. We know that they are actually being treated by outreach again, that's a different question. So there's questions about folks outside of, on the back end of the process, if they're not with us, and further on the front end of the process, if they're not with us, referred to us. And those are things that we're not gonna have access to. And that is why, to Stacy's earlier point, there's a number of parties, and that needs to come together with how the data is going to be managed and presented, right? So I just want to make sure that part is clear.
Amy?
Can I just piggyback off of that? Is, you're saying that is being reported in it, how can we access that? Because I think that's part of the confusion too, is when is that gonna be available?
We provided initial reports at the CAB meeting. There was a request to actually standardize, and so that is what we're.
You provided a report at the last meeting in December.
Yes, exactly. So there was a request to actually drill down and actually have additional information. That request is between the city and ourselves. We will provide updated information at the CAB meeting.
Okay, so it's for the CAB, not like something that's publicly available.
So
If
let
we
me,
get
let me
it.
explain how a CAB works.
Yeah, thank you.
A CAB is a community advisory board. Everybody who sits on that CAB gets the information. So you're appointed to the CAB to be able to share the information. So whatever information we get from Community Board One at the CAB, we have on file for the office for anyone who needs it. Anyone from the Clyde West group who goes to the CAB gets information and is eligible to share all that information with the public. It's not a closed wall, it's just a smaller group.
That's why I was saying who's your representative on CAB.
Right.
Yeah.
Whereas, you know, if we have, let's call it 25 people in the room today, right? They have, from one particular organization, they have representatives from a variety of different, including the businesses and the church and others. So the information that gets shared there then should be shared out by the people who are at the camp. Does that make sense?
That's helpful, thank you.
No problem.
All right, it's your hard stop.
If you don't mind, let's just ask if there's any more questions in the room and any more questions online. This is the first public experience that you've had here. And I think it's really great that you came. I appreciate coming outside the CAB because this community is getting to learn.
Zach has a question.
That.
No, I just, if we're closing, I know the hope count is a very important part of how we find out the numbers of street homeless in the neighborhood. And I wanted to know if you guys just want to make a quick pitch for that, because that's coming up.
Yeah, don't you need volunteers?
That, the hope count is on the 28th, Tuesday the 28th, and it's basically, New Yorkers volunteer to go out and to count the number of street homeless individuals living on the street. So we engage every individual that we encounter, assess whether they're homeless or not, and then document it for our survey. That is it.
Where do we get that to put on our website? Is there a flyer? Is there?
Yeah, I'll share the information tomorrow.
Thank you. And then, do we meet in a specific place? Do we have to register to how?
You have to register. There's a number of locations where you could go to convene. Then at 12 o'clock, teams go out and you work in teams. So it's not an individual surveying these, the street homeless individuals. It's a team of individuals going out into the community and conducting a survey.
It's 12 midnight.
12 midnight, but the whole count starts at 10 for the training. There will be refreshments and, you know, an opportunity to meet some of your neighbors. And then at 12 o'clock, folks start going out into the street from 12 to 4 to conduct the count.
So if anybody wants to volunteer. I saw one less hand over here.
The 28th.
It was actually, but go ahead. She's not saying anything.
Hi, Janine Lesnick, part of Friday West. I think this is maybe a question for you two and maybe also for the community board. So, and thank you guys for coming, but this is not necessarily relevant to you. So knowing that 99 is closing and knowing that that is run by Health and Human Services. And I guess my question is, because you guys have more insight into the agencies, what other types of shelters could we as residents be surprised by? Because what we learned is that that was run by H&H, this one by DSS.
Like, remember, we told you the developer, the owner of
But
that
so
building.
what other agencies that do we not know about and that could approve a different type of shelter? Like what other surprises? Like, is there a list of all the agencies that could approve any type of shelter that could come in? How can we get access?
So here's, I hear what you're asking. We are coming out of the COVID-19 pandemic, for which emergency orders were put down that allowed different things to happen than are happening now. Most of those emergency orders, if I'm correct, Tracy, and everybody are gone, right? So we're operating under regular city policy, right, Max? So with that, New York City Health and Hospitals dealt with the migrant crisis incoming. They don't have anything, as far as I understand, to do with setting up of homeless shelters. That's a different business model, it's a different RFP process, it's different providers. So you gotta understand that it's apples and oranges to the city, right? In the ideal
Yeah.
situation.
I'm just trying to figure out, is there a grapefruit hanging out we don't know about?
I don't think that these
It's
guys,
called-
we can't answer that
Yeah,
question.
can't be,
We can't predict the future. We don't know the future.
But also, you can't speak to what other agencies actually.
Yeah, we don't
want to do.
have that.
I mean, there's Trevor Clapton, the mayor spoke today, right? He spoke about
Opening.
significant amount of funds and 900 more, I believe, safe haven beds, so.
Yes,
So.
600.
That's hyper.
600.
It's 900, but nevertheless, a large amount.
Still a large amount.
I think within the four boroughs, I think the community is quite concerned after having lived through two shelters within 20 feet of each other about what happened. This block cannot sustain, and so it's kind of like playing whack-a-mole, and you get surprised by what you don't know.
I don't know about the surprise. I know that for our shelter, we were a planned shelter with full notification. I can't.
There, 105 Washington was planned prior to COVID-19. I mean, quite frankly, they came to us, I think, 10 years ago.
Yes.
It was.
Let's not debate that part.
We're not gonna debate the founding of it because the city owns the building, I believe, right?
We own it, they financed it,
They
in the
bought it.
contract.
Correct. So, I mean, it's an owned permanent location. And the first time it was contemplated, was sometime in the 2010s.
We're gonna say 2015.
Yeah, 2015. So it's been a long time.
We're
And that's very different from emergency
Max
orders.
wants to say something.
Max
Yeah.
and then this.
I guess, just based on our office's knowledge of working with every city agency, the only type of shelters that I'm aware of that could be done, right, you have the DSS shelters, DHS shelters, right, health and hospitals under the emergency order can do the HERF, and then the only other kind of shelter I'm aware of is HPD emergency housing for people who have been displaced by fires. Which again, and there's absolutely nothing to suggest HPD has any interest in buying this hotel for that, but yeah, as far as like any other kind of shelter, agency run shelter, the only other agency I know of that would do that would be HPD, and the only kind of shelters they run are for people who have been displaced from, or any kind of vacate order or emergency.
Thank you, Max, that was the answer I was looking for, and then I guess just to clarify, so we have a safe haven health shelter in Community Board 1. What
More than
other,
one.
so what other shelters, like, are there other capacity issues? What other types of shelters could be put down here that?
Exactly what Max said.
Yeah.
HPD can do shelters, DSS can do shelters, DHS.
ESS approve another shelter on that same block?
And if that's what the developer wanted to do.
Hence,
this
hence
building.
my question at the top of the meeting. Do you know any addresses anywhere around, including but not limited to?
Got it.
Yeah.
Okay, they had a hard stop. I'm sorry.
Yeah,
Yes, we had a hard stop. We gotta go.
Just quickly, there are also domestic violence shelters, which are confidential. And then there are emergency housing for people with HIV and AIDS.
And we have a variety of them, but we're not at liberty, I mean.
Right, they're confidential.
Okay. Thank you.
Just you had to.
Thank you.
Thanks for the community members for donating. I really do appreciate it. The clients love helping. Thank you for that. Thank you.
So again, if we have something, can we just knock on the door?
It was very nice seeing y'all again.
Some of the neighbors that just passed again.
We can just knock on.
Yeah. They call me.
We have to call it.
No, they just.
What trees?
Toiletries are always.
Great job.
Like body washes.
You said socks.
Socks are always needed.
Socks, shower slippers, because it's a shared shower caddies.
Shower caddy, okay.
I think we're gonna give a list to the cab next.
Yeah, would you please? I think we asked that, yeah. Thank you, everybody, for coming. Stay warm. Happy New Year. We'll see you at the-
Sheets, their numbers.
Thank you.